Vaginal itching is one of the most uncomfortable symptoms one can experience. But what if you're itching with no smell, no discharge, and no obvious infection? The common mistake many women make is that they think every vaginal itching is a yeast infection, and they start treating themselves, not knowing that they're making things worse. The truth is, itching without discharge can have several causes. So in this video, I'll be explaining the reasons for vaginal itching without discharge, what you can do, and when you should see your doctor. Hi, welcome back to Know Your Health with Dr. Lucy, a space where we share everything concerning your health and pregnancy. If this is your first time joining us, you're most welcome. Don't forget to join the family for more educative videos like this. Alright, itching down there without discharge usually means there is an irritation or inflammation and not necessarily an infection. One thing you should know is that the vaginal area is very sensitive. Any small changes can trigger itching. Now, one of the most common causes of vaginal itching without discharge is irritation from soaps and personal care products. The skin around the vagina, especially the vulva, is very sensitive, and many soaps, body washes, and vaginal wipes contain harsh chemicals that can strip away the natural protective oils and disturb the natural pH of your vagina. And when this happens, the skin of your vagina becomes dry, inflamed, and itchy, even though there is no infection or discharge. Some women also experience redness or burning sensation, especially after having a shower. So in order to prevent this kind of itching, you should avoid products like scented soaps or body washes for cleaning your vagina. Avoid douching. Do not use feminine wipes. These are very dangerous. The best approach is to clean the surrounding area of your private part with plain, clean water and keep it well ventilated. Another common reason for vaginal itching without discharge is an allergic reaction. This happens when your body reacts to something it sees as harmful. The skin around the vagina can become itchy, reddish, swollen, or even irritated. Although this does not happen to everyone, because we all have different bodies and may be allergic to something yet you're not. So some women can be allergic to things like condoms, vaginal lubricants, or sperm seeds. Some women can also be allergic to common sanitary pads or panty liners, or even tampons. In that whenever they use these products, they suddenly start feeling itchy down there. Some go as far as noticing burning sensation, redness, or even mild swelling. So in case you suddenly start feeling itchy down there, first recall what you've used recently. Maybe you're actually allergic to it. The best solution for this allergic reaction is to actually identify the suspected product and stop using it. The problem is many women notice these changes, but they choose to ignore it, not knowing that they're causing themselves more harm in the long run. So if this itching continues, even after avoiding the trigger, it's important to see your doctor to find out the real cause. Vaginal dryness is another common cause of vaginal itching without discharge. Normally, the vagina produces natural moisture that keeps the tissue soft and protected. When this moisture reduces, the vaginal area becomes dry, itchy, and irritated. Some women may feel soreness or mild burning, especially during walking or during sex. This vaginal dryness often happens due to hormonal changes, especially during breastfeeding, after childbirth, during menopause, or even when you're stressed, or when you're using certain hormonal medications like contraceptive pills. Vaginal dryness can often be prevented or reduced with simple daily habits like staying hydrated. Drinking enough water helps to keep all body tissues, including vaginal tissues, healthy and moisturized. Avoid overwashing your vagina. Washing your vagina too often removes natural oils and makes dryness worse. Gentle cleaning once daily is enough. For dryness during sex, use water-based lubricants. It can reduce friction and discomfort. But make sure you're not allergic to this lubricant because it can make things worse. And if this dryness is persistent and associated with pain, please make sure to see your doctor. Wearing very tight clothing is another common cause of vaginal itching without discharge. Very tight underwear, leggings, or trousers can trap heat and moisture around the vaginal area, which creates irritation and makes the skin feel itchy and uncomfortable. When there is poor airflow, sweat builds up and the skin becomes warm, damp and sensitive. Even without an infection, this irritation alone can cause itching, redness, and soreness. To prevent this, wear loose-fitting clothes, choose cotton underwear, and also allow the area to breathe, especially at night. Sometimes vaginal itching without discharge is caused by skin conditions, not an infection. Just like the skin on other parts of the body, the skin around the vagina, called the vulva, can be affected by conditions like eczema, dermatitis, or psoriasis. These conditions can cause persistent itching, redness, and dryness. So, if you experience persistent vaginal itching without discharge, please visit your doctor for proper diagnosis and treatment. Seeking for help early can prevent complications and bring lasting relief. For those who have vaginal itching with discharge, check out this video. I explain all the different types of vaginal discharge and what they mean. Thank you all for watching. If you found this video helpful, don't forget to like, share, and subscribe to this channel for more health information. Bye!